I've been able to walk to work while I've lived here, so I've been really relishing that, and it's lovely to be like living in and near the community that I'm working in, and just to know the area well is nice. When you're talking to patients, you understand where they're coming from, and that was one thing I really found I didn't have when I was in Australia, was that people would say where they're coming from and I didn't know where that was necessarily because I was new to Western Australia. So here I kind of can have a picture in my mind of where the person is living and the circumstances that they might be in, and that's lovely. When I came back from Perth, I did a medical BST first and was thinking about doing geriatrics, but during that time I kind of came to the realisation that GP was where I wanted to go next, and haven't really looked back since. So I spent my first year out of hospitals in practice in Ballymun, which was based in a large primary care centre, and Ballymun would have a very young population, lots of young families, and lots of different issues and people with different comorbidities. So it was interesting learning to manage that, and working as part of the primary care team. We had a lot of involvement from our local public health nurses there, and good support from community services. The population in Fairview differs a little bit. It is quite an elderly population here, but there are new families moving into the area as well. So it was lovely to see the differences between the two practices. Both were great and really good learning opportunities, and have set me up well for the future. I'm often talking to my trainers, and they would say they remember the patients, they remember the patient's mother, and they always know their children as well. And sometimes the children may have moved away and still come back here to see Dr. Bates and Dr. Carmody. So they really have a very loyal cohort of patients who've been with them the whole time that they've been here, and that really adds value to, I think, their careers, as well as adding value to the patients and providing them with better care. A typical day, it's so incredibly varied in the types of patients I might be seeing. I might have an antenatal visit first thing, and then have a small child in with a viral illness. You can then have an elderly person in for their chronic disease management visit, which is always quite nice, a little bit of time to catch up with them and see how things are going generally, and do a little check for them if they have any problems. You might have somebody coming back for a review after a hospital stay, and it's interesting to just talk to them through what they might have experienced in the hospital, answer any worries or concerns they might have. You may have an acute presentation that you need to kind of urgently send off to hospital then, and then you might have some more routine care, like providing a cervical check and maybe advice for somebody who's going travelling or needs advice before their holidays. So it can really vary day to day. I'd say GP is an incredible career if you love diversity within medical practice, if you really enjoy working with people, if you want to get an insight into people's lives and the variety of things that they might come up against, and really make a difference in helping them with those problems. There's a lot of opportunity to reassure people about things they might be worried about, and sometimes all you're doing for them is providing a listening ear and just being a person of support to them through their illness and their journey in healthcare. But really, it's a career in which you'd never be bored. It's satisfying every day, and you really get a sense of it's incredibly rewarding when somebody comes back to you and tells you that the treatment that you've given them has worked for them.